Good day everyone, my name is Christine Alam Sumawang from BSN1B, and for today I will be conducting an assessment on the eyes. So first that we need to do is we need to assemble the equipment and supplies: cotton tip applicator, examination gloves, millimeter ruler, pen light, opaque card. So let us now proceed to our procedure. First thing that we need to do is we need to introduce ourselves to the patient and assess the patient's ability to assist with our procedure. And so, good day sir, my name is Chris and I will be your nurse for today. May I know your name?
Adjan Palencio po.
Okay, sir, may I please look at your name tag? Thank you. Third thing that we need to do is we need to perform hand hygiene and observe the appropriate infection control procedure. So for our fourth step, we need to provide the client a privacy by closing the curtains around bed or closing the door to room if possible. So for our fifth step, we need to inquire if the client has any history of the following. Sir, meron po ba kayong family history ng diabetes?
Wala po.
Hypertension po?
Wala rin po.
Blood dichresia po?
Wala rin po.
Okay. So meron po ba kayong, nagkaroon na po ba kayo ng eye disease?
Wala po.
Have you got an eye injury
Wala po.
or surgery?
Wala po.
And last visit nyo po ng ophthalmologist?
Hindi pa po nakapag-visit.
Okay. Current use of eye medications? Nagtitake na po ba kayo ng eye medications?
Hindi po.
And gumagamit po ba kayo ng contact lenses?
Hindi po.
And meron po ba kayong mga hygienic practices for corrective lenses po?
Wala po.
And lastly, meron po ba kayong current symptoms ng mga eye problems?
Wala po.
Okay, thank you po. We will now proceed to the assessing of the external eye structure. First is we need to inspect the eyebrows for hair distribution and alignment and for the skin quality and movement. Sir, tingin lang po sa akin. Okay. Next is we need to inspect the eyelashes for evenness and distribution of the direction of the curve. Okay. So 8, we need to inspect the eyelids for surface characteristic, position in relation to the cornea, ability to blink, and frequency of blinking. Inspect the lower eyelids while the client's eyes are closed. So, sir, tingin lang po sa akin. Okay. Sir, pikit po kayo. Okay. So for our 9th step, we need to inspect the bulbar conjunctiva for color, texture, and the presence of lesions. Sir, tingin lang po sa akin. Okay, thank you po. So for our 10th step, we need to inspect the palpebral conjunctiva by everting the eyelids. Okay, thank you po. Next is our 11th step. We need to avert the upper lids of if a problem is suspected, ask the client to look down while keeping the eyelids slightly open and gently grasp the client's eyelashes with thumb and forefinger, pulling the lashes gently downwards. Okay, now we need to place a cotton tip applicator stick about 1 cm above the lid margin and push it gently downward while holding the eyelashes. Sir, pikit po tayo. Your eye po. Okay, sir, thank you po. Next is we need to hold the margin of the eye inverted lid on eyelashes against the ridge of the upper bony orbit with the applicator stick or your thumb. Okay, sir, pikit po tayo. Okay, sir, thank you po. And inspect the conjunctiva for color, texture, lesion, and foreign bodies. sir. Open our eyes po. Okay, thank you po. So for our 12th step, we need to inspect and palpate the lacrimal gland. Using the tip of your index finger, palpate the lacrimal gland. Observe for edema between the lower lid and the nose. Sir? Okay, thank you po. So for our 13th step, we need to inspect and palpate the lacrimal sac and nasolacrimal ducts. Observe for evidence increased tearing. Using the tip of your index finger, palpate inside the lower orbital rim near the inner canthus. Sir, I will i-assess ko na po yung lacrimal sac. Okay. So for our 14th step, we need to inspect the cornea for clarity and texture. Ask the client to look straight ahead. Hold the pen light in an oblique angle to the eye and move the light slowly across the corneal surface. So tingin lang po sa akin. Okay, thank you po. And for our 15th step, we need to perform the corneal sensitivity reflex test to determine the function of the fifth cranial nerve. Ask the client to keep both eyes open and look straight ahead. Approach from behind the beside the client, and lightly touch the cornea with a corner of the gouge. Okay, thank you po. So for our 16th step, we need to inspect the pupils for color, shape, and symmetry of size. Okay, thank you po. And for our 17th step, we need to assess each pupil's direct and consensual reaction to light. Partially darken a room. Ask the client to look straight ahead using a pen light, and approaching from the side, shine a light on the pupil. Next is we need to observe the response of the pupil should constrict, and shine the light on the pupil again and observe the response of the other pupil. It should also constrict. Okay sir, tingin lang po sa akin. Thank you po. So for our 18th step, we need to assess each pupil's reaction to accommodation. Hold the object about 10 centimeters from the client's nose. Ask the client to look first at the top of the object and then at the distant object behind the object. Alternate the gaze between the near and the far object. So tingin lang po dito sa may tip ng pen light natin. Okay, tingin po sa wall. Tingin po ulit dito. Tingin po ulit sa wall. Okay po. So for our next step, we need to move the pen light or the pencil towards the client's nose. The pupil should converge to record normal assessment of the pupils. Use the abbreviation PERRLA. So, sir, tingin lang po dito sa pen light. Okay, sir. Thank you po. Now we will proceed to the assessment of the patient's visual fields. First is we need to assess the peripheral visual fields. Have the patient sit directly facing you at a distance of 60 to 90 centimeters. Ask the client to cover the right eye with the card and look directly at your nose. So cover or close your eyes directly opposite to the client's covered eye and look directly at the client's nose. So next, we need to hold an object in our fingers, extend our arm, and move the object into the visual field from the various points in the periphery. The object should be at an equal distance from the client and yourself. Ask the client to tell you when the moving object is first spotted. So sir, cover po natin ang ating right eye. Okay, sir, i-determine nyo lang po kung saan po dito ang unang gagalaw. Okay, sir. Okay, again po.
Dito.
Okay, angat. Cover po natin yung ating left eye. Again po.
Dito.
Okay po. So, to test the temporal field of the eye, left eye, extend and move your right arm in from the client's right periphery. Temporarily, peripheral objects can be seen at the right angle to the central point of vision. Next is to test the upward field of the left eye. We need to extend and move the right arm down from the upward periphery, and the upward field of vision is normally 50 degrees because the orbital edge is in the way. Next is we need to test the downward field of the eye. The left eye, extend and move the right arm up from the lower periphery and downward. The downward field of vision is normally 70 degrees because the cheekbone is in the way. Next is to test the nasal field of the left eye. Extend and move your left arm in from the periphery. The nasal field of vision is normally 50 degrees away from the central point because the nose is in the way. Next is we need to repeat above the steps from the right eye. So sir, ide-determine nyo lang po kung anong number ang nasa harapan nyo. Tingin lang po sa akin. First, we need to cover our right eye po muna. Okay.
2, 1, 2, 1, 1, 2,
Okay, our left, cover po ang ating left.
2, 1, 2, 1.
Okay. So we will now proceed to the extraocular muscle test. We need to assess the six ocular movements to determine eye alignment and condition. First is we need to stand directly in front of the client and hold the pen light at the comfortable distance such as 30 centimeters in front of the client's eye. Ask the client to hold head in a fixed position facing you and follow the movements of the pen light with the eyes only. Move the pen light in slow, orderly manner through the 6 cardinal fields of gaze. Stop the movement of the pen light periodically so that the nystagmus can be detected. So sir, susundan nyo lang po ang light. Tingin lang po sa akin. Ang eye lang po ang gagalaw. Susundan po ang light. Okay sir? Okay sir, thank you po. So for our next step, we need to assess the location of the light reflex by shining the pen light on the pupil in a corneal surface. So sir, tingin lang po ulit sa akin. Okay, thank you po. So for our next step, we need to have the client fixate on a near or far object, cover one eye and observe for the movement in the uncovered eye. So sir, tingin lang po ulit. And susundan lang, we need to cover po our eye. Okay. Titingin lang po dito sa tip of the pen. Okay sir, thank you po. Now we will proceed. Tingin po sa malayo, sa taas po, sa ceiling. And sa floor po. And the right and the left side. Thank you po sir. Now we will proceed to the visual acuity of the patient. The first thing that we need to do is we need to assess the near vision by providing adequate lighting and asking the patient to read from a magazine or a newspaper. Okay, sir, can you please read this in a near vision?
Yeah.
This one.
Basic contact will be about 1 centimeter above the leaf margin.
Okay. So for our next step, we need to assess the distance vision by asking the client to wear corrective lenses unless they are used for reading only. Okay, since our client is not wearing corrective lenses, we will proceed now to asking the client to sit or stand about 6 meters or 20 feet away from the Snellen chart. We will ask him to cover the eye not being tested and identify the letters or characters in the Snellen chart. We need to take 3 readings. We need to assess the right eye, the left eye, and both the eyes. So sir, cover po natin ang ating right eye. Okay sir, pakibasa po ang ating Snellen chart.
E, F, E, T, O, Z, L, P, E, D, F, E, C, F,
Okay sir, thank you po. And ang ating left eye po, paki-cover. Pakibasa po ulit.
E, F, P, T, O, Z, L, P, E, D, P, E, C, F, D, E, D, F, C, E, P,
Okay po, thank you po. Using your both eyes po, pakibasa po.
E, F, P, T, O, Z, L, F, E, D, F, E, C, F, D, E, D, F, C, Z, P, F, E, L, O, F, Z, D.
Okay sir, thank you po. So next, for our documentation, we need to document our findings in the client's record. So that would be all for the assessment of the eyes. Thank you.